The patient is the most important link in the whole chain. I'm Dr. David Kuplic. I'm an orthopedic surgeon. I've been in practice here in Appleton for 12 years. Did my medical school and residency in St. Louis at Washington University, and then came back home. Wisconsin is home for me. I'm originally from the Sheboygan area, Sheboygan Falls to be specific, and Appleton was where I wanted to raise my family, where I wanted to start my practice. I always liked kids. I like working with kids. In fact, I went to medical school. I thought I was going to be a pediatrician. Was in the environment of the operating room and taking care of some injured athletes, and I thought, this is it. This is what I want to do. But I had this wealth of pediatric experience and this love for taking care of kids that I knew I had to put it to use in my practice. So it's always been incorporated as part of my practice here in the Valley. I really like taking care of that high school, junior high athlete who's trying to get back in the game, trying to get back to the things that they love, that passion, pure love for the game that they have at that age. And they're really motivated patients that are a lot of fun to take care of. Family is very important to me. I have a very supportive wife and 3 wonderful children. Some of my patients recognize some of my children because I enjoy having them tag along with me. Certain times on the weekends I'll bring them around on rounds with me. I remember going on rounds with my father, and I wanted my kids to have that same experience. I love golf, I love basketball. My family likes to ski. We do outdoors activities such as boating together. So a lot of family-oriented activities, because that's what I want to do the rest of my life, is be able to hang out with my kids or grandkids and do those kind of fun things. The patient is the most important link in the whole chain, and you really need to do what's best for your patient. Many of these things that are happening to the patients, and myself and my team have done hundreds of times before, but it's unique for the patients for their first time through this. And so they don't have that perspective, and you have to teach them I understand your concern for the moment, but we're going to get you there. I want all my patients to have the best result possible. And so that's very motivating, to try and do your best work every single time. In this profession, quite honestly, gets to be a calling. You just sort of feel, I'm in this for a reason. I'm doing this because I like to, because I think that I do a good job at it, and that I can take good care of patients. So in that sense, it's what you're destined to do. It's what you want to do. The most important reason to be in medicine is because you care about people and you really want them to get better. You really want to help them make a difference. And that is a relationship. So you have to develop that relationship that they can put their trust in you to get that repaired, get that fixed. And then as you take them through that process and get them healed, it's not a one step and done. It's a journey, and that journey is that's where the fun is. You know, taking somebody who is disabled and then coming back to where they want to be. That's powerful, and makes you feel great, makes them feel great, and you really connect with your patients that way. I think that's the joy of medicine.